Hello everyone. Today I'll introduce you to Staphylococcal skin infections due to Staphylococcus epidermidis. First, about the disease and agents. We can call this disease staph infections. There are three clinical forms: folliculitis, furuncle, carbuncle, and impetigo. About the agents, the primary pathogen is Staphylococcus epidermidis. They are gram-positive cocci and they arrange in grape-like cluster. We can see here there are lots of purple cocci and they arrange in grape-like. 2. Transmission and epidemiology. They have two types of transmission: direct contact, skin to skin, and indirect contact via formite, for example, towel. We also need to remember about carriers. This is a high risk from asymptomatic carrier. About epidemiology, they are widespread distribution. In 2000 to 2010, there was significant increase in TSTI admission historically. We can see here this blue line is higher than orange and purple one. The blue line is SSTIs. 3. Structure and virulent factors. As I said before, they are gram-positive cocci and arranged in grape-like. They have two enzymes coagulase that clot plasma to protect bacteria, hyaluronidase that degrades tissue cement. They also have protein A, a surface factor that binds antibodies to evade immune response. They also have two types of toxins: exfoliative toxin and TSST1, known as toxic shock. We can see here that is coagulase, protein A, and TSSA. They also have some surface factors such as elastin binding protein, collagen binding protein, fibronectin binding protein, and clumping factor. 4. Symptom and pathophysiology. We can see some infection signs, for example, skin, including hair follicles, epidermis, dermis. The first clinical form is furuncle. This is swollen, painful, pus-filled lesion. The second one is impetigo. This is vesicle rupture to form characteristic honey color crust. And the last one, is colitis. This is red, swollen, warm, painful area with undefined border. In case of a severe progression, if bacteria enter the bloodstream, they can cause septicemia and multi-organ failure. We can see here, besides skin and hair follicle, they can cause disease at stomach, nose, lungs, heart, and kidney. More about pathophysiology. First, adhesion mechanism to artificial surface. This is the most important step. With two adhesion factors, MS-CRAM, micro, microbial surface components recognizing adhesion matrix molecules, and PIA, polysaccharide intercellular adhesion. Second, biofilm formation. This is the most important pathogenic mechanism. This includes three states. State 1, adhesion to the surface. State 2, accumulation and maturation. State 3, dispersion cell escape into the bloodstream. They can cause mild moderate sepsis and preventing antibiotics from diffusing into them and causing multi-drug resistance (MRSE). Number 3, immune evasion mechanism. It includes biofilm. This helps bacteria resist oxygen and phagocytosis. PIA resists lysosome and antibacterial peptides. This helps bacteria survive on the device for a long time. And C, altering the cell surface, help avoid early detection. 5, diagnosis and treatment. We can use the method culture and antibiotic susceptibility testing. We also have some biochemical tests, catalase test with positive result, coagula test with negative result. On monitor soil aura, we will have a yellow colony. MSA is for isolation Staphylococcus. About the treatment, we can use antibiotics, TMP, SMZ, clindamycin for mild cases, and vancomycin for severe or resistant infections. If there are a lot of pus on the lesion, we can drain pus. We can drain pus here, and these are two antibiotics, clindamycin and vancomycin. 6, about prevention and clinical relevance. Prevention. We need to remember two important things: hygiene and medical device. Hygiene. We should frequent hand washing, keep wounds clean, and avoid sharing personal items. With medical device, we should proper use, cleaning, and disposal of medical device so they have a clinical significance. They help limit cross infection in hospital and in our community. Their hand washing steps, and this is cleaning medical device. And here is reference. I use the following structures for my presentation. I want to thank you, Dr. James, for your lecture, chapter 15 and chapter 14. So, thank you for watching, and I look forward to hearing from you. Thank you.